Okay, I've got 1 o'clock Eastern, so I think we're going to go ahead and get started. So welcome everyone, and thank you for joining the Getting Started with StoryCare webinar. And my name is Steve Powell. I am one of the co-founders of StoryCare, which is the product that we'll be talking about, and learning system that we'll be talking about today. That's specifically a system that is for use by educators, clinical educators, also faculty, and the healthcare professional area, and with an emphasis on patient safety, patient experience or patient-centered care, and also quality improvement. Including in there, we will talk a little bit today about stories that are specifically will help with learning of skills like team steps, and also other competencies that we're trying to develop with our students or our learners, wherever they might be. They might be team members within a healthcare facility, like the QSIN competencies, which is quality, safety, education for nurses. So without further ado, I'd really like to welcome everyone. I know we have quite a few users of StoryCare on the line, so current users are here. Also, some folks that have been trial users that have been trying out StoryCare, especially during the COVID-19 crisis. We opened the system up right after the crisis started, especially for those that were forced into some virtual situations with students. That was very very disruptive, and still to this day is for a lot of schools, and also for a lot of facilities trying to continue their training efforts. So we were supporting those trial users. And anyone who wants a trial, we still are offering those trials to users, and I'll talk about some ways you can get involved in that. And also there's some new visitors here today. I saw folks registering that aren't in either of those categories, that are new to StoryCare, or new to the concept of using stories. And so we've got something for you as well. So again, my co-facilitator today is Dr. Gwen Sherwood. She's a professor emeritus from the University of North Carolina, Chapel Hill School of Nursing, also my alma mater. And again, we have been working together for over a decade in this area of patient safety and quality improvement. And our first times together was during the development of the Team Steps program many years back, but have been collaborating in this area of narrative pedagogy and also reflective learning over the years. So again, welcome Gwen as well. And Gwen will be our lead faculty today with the StoryCare portion of the simulation that we'll be doing. And so you'll get a chance to meet her. So Gwen, anything you want to say before we keep moving on with the webinar?
Oh, welcome to all the nurse faculty, regardless of what setting that you're in. We're just really delighted to be able to work with you. Story is such a powerful way to teach. So we look forward to talking with you about that today.
Great. And I do want to let everyone know that we are recording today's webinar. And just so you know that, everyone's on mute, but we're going to be chatting a lot. And there's a chat box feature in the Zoom webinar feature, so feel free to chat us anything you like. We'll have actually a couple of questions after the StoryCare simulation that you'll be able to also participate. We really are hoping that you will participate on the chat with us. So again, feel free to chat anytime. We'll try to be aware of those as they pop up, and that'll keep the discussion going as well. You may want to have a headset if it makes it easier for you to hear, because we'll be playing one of the StoryCare simulations. It makes it easier sometimes to get that. So as I said, I'm on the main website for StoryCare, which is join.storycare.com. And if you go to join.storycare.com, you can learn more about StoryCare. There's plenty to learn on this website. And I will show you that there is also a place that has a little video that pops up, and it show you on the screen here. And you can play that video. It gives you an idea, a little bit of the flavor of what you're going to experience today, but anytime if you want to share that with someone else. Also, there's a couple of buttons here if you are interested. Like I said, if you haven't got into the trial, feel free to push on this start free trial. There's just a simple way to fill that in. And if you are ready after you've trialed and you're ready to purchase, there's also a purchase button. Lots more great information about StoryCare here. And also in our blog space on join.storycare.com is where we'll post the recording for this webinar. So that way, if you want another colleague to see what we're doing today, that's a great way to do it. So, all right, without further ado, I am going to move over to, once you do have that free trial or you've purchased, you're inside the system, you'll get a username and a login. And once you go to the landing page, you will get to our storycare.com landing page. And Gwen, just double checking with you that I'm showing the StoryCare main page on.
Yes.
Okay. Great, thank you, ma'am. All right, so with that, today, kind of go through a simulation with you is there are three kind of user areas that if you want to take a look at when you first log in. And one of those areas, if you are an academic user, it has a great little tool that you can use to get like a little tutorial. If you're a clinical educator and you want to look at more for a hospital or clinic setting, use the clinical user there. And if you're a CUSIN user, it will take you through a tutorial that's specific for CUSIN. Today, I'm kind of pretending that I am a faculty member, and we'll pass it over to my actual faculty member for Gwen. And in that, I am going to click on the story library. And in the story library, let me see here. I will get my get everybody in the library. Okay, here we go. And in the library, we will kind of take a look, and we'll have a chance. My story that I'm very interested in is a story. Let me turn off my little annotator here for a moment, and just so you can kind of see what I'm doing. So, and there we go. So you should, let's see, make sure that this, I'm having a little technical difficulty with the Zoom side of this. So be just a moment here. I'll manage that and come back on in the sharing mode just in a moment. So let me get back to where I was here. Okay, here we go.
While you're working on that, Steve, I thought I would just fill in a little bit and what you would be thinking about as you're in the step that Steve is setting up for us is thinking about what's your overall teaching objective? What's your goal that you are trying to establish in terms of looking for a story? These are crosswalked with the CUSIN competency, so you might be planning a lesson focused on one of those 6 competencies of patient-centered care, the teamwork and collaboration, evidence-based practice, quality improvement, safety, or informatics. And so it's very easy through StoryCare and the drop-down menus that you're able to click on whatever you're trying to focus on and find stories that line up with that. Or you might be focusing on some of the team steps competencies, as we are going to be today. We're going to be working on communication. And so we have gone through, and we've already gone through some of those steps and pre-selected a story. But of course, always you're beginning with what's the overall objective that you're trying to achieve in terms of what is your objective and what's the lesson plan. So you need to be thinking about in terms of the story that you select, what's the knowledge that the student needs to already have? What skills are you trying to build? And are you trying to change attitudes? Stories have they're very complex, so they have a lot of dimensions. So it helps us to deal with multiple perspectives of a particular situation. So those are some of the things that you would be thinking about in trying to go to the story. And I think Steve has been able to wrestle Zoom and
Yes,
to
I think so.
getting us lined up again.
Okay, well, let's try again here. And it looks like it's actually sharing what we're looking to share. In this case, like Gwen said, our startup was around, we were going to focus on a Team Steps tool today, communication tool. And one of those tools is going to be Check Back. So I'm going to click on Check Back, and Team Steps, the Team Steps has a library if you were working on Team Steps, which is strategies and tools to enhance performance and patient safety. I have to give $1 every time I don't spell out an acronym the first time. So today we found a great story, and we had kind of pre-looked at this, and this is a story about patient discharge, and goes back to what Gwen was saying, is you also want to understand the context in which the story might be advantageous to where you're teaching specific students. So I'm going to click on that particular story, and this story is called Close the Loop, and it's all about closed loop communication. And over on the left side for new users, there is a way, if I wanted to add this story, I could add it to my story vault. So it's kind of like making it a favorite if I want to do that. And you can see right away that these are audio stories. We'll be playing the story in just a moment. There's also a discussion guide. There's a story handout. There's a little poster that is can be used as screensaver, or it can be used to kind of highlight the story that you're working through. And you can see that there's a student guide. And if for the student, when the student gets their StoryCare login, they will see their student guide, but they will not see the instructor guide, where this is an instructor view, and they get to see the actual instructor guide. So I'm going to open that up. And very quickly, you can see that this is a great tool that the instructor can use, the faculty can use to get prepared and kind of see what's in this story. So I'll turn it over to Gwen. She's going to kind of walk us through the instructor guide for Close the Loop, story 196.
I find it really helpful that when I'm using StoryCare and I've decided what I'm going to be focusing a particular lesson on, that I can go to the instructor guide and see what has already been worked on and set up. And I don't know, Steve, if you can scroll down, but they've already developed and worked on some ways, some objectives that you can use. And of course, the great thing is that then you can also adapt these for whatever level of learner you're working with. If you're teaching a class in medical surgical, or if you're teaching the class in a maternal child, you can adapt and use these questions for developing the competencies. So you'll see there, if you are focusing on cues and competencies, these have been highlighted in this story: patient-centered care, safety, teamwork, and collaboration. But as you'll see when we go through the story, for higher level learner, you could also add evidence-based practice, quality improvement, informatics applications. So within Team Steps, checkbacks is one of the skills. So, you know, a competency is the knowledge, skills, and attitudes. So this does allow learners to work on the skill of check back as a standardized communication. I'm not going to read through those for you today, but when we play this story in just a minute, right here, this first question is one that we're actually going to be working on. We're going to work on this first question as a group to think about points in the story where the staff could have verified that the patient or her son understood the message. Now, you have, as a faculty, the privilege of seeing some prompts that have already been developed. If this were the student guide, you would only see the question. You wouldn't see the prompts, of course. So you can use these for virtual or face-to-face. You can use it with individual learners, or you can set up an entire class and put students in. You know, Zoom allows you to break a large class into groups who could work on the questions as groups, and you as faculty could move around amongst the groups. So there are many different activities. This uses the concept of mastery learning, which allows practice. And so again, you can see how you could even use the rubric here for level 1, 2, and 3 as just a beginning assessment guide for how you might be able to assess how well the students are doing. So I think at this point, it would be, you have a little bit of a quick view of what's here. You can see a number of the concepts within safety coming in there, a quick look at human factors, some of Don Berwick's work. So you can go on down through various levels, and here are some other skills that you could also dwell on if you, just depending on where you are, what kind of learner that you're working with. But I think now, Steve, we might go ahead and play the audio, because that will be a great springboard for us to see how this works and to be able to engage the audience today in some discussion through chat.
Great. I'm going to go ahead and start the story. So here is our story 196. And if you'll just give me a thumbs up that the sound is actually working. So Gwen, and we'll go ahead and start that story.
When Holly Norton's son brought her to the ER complaining of chest pain, it was obvious that addressing her medical condition was going to require walking a very fine line. The attending physician, Dr. Colin Singer, stood in the hall When he came in and sat down with Holly and her son, he tried.
And Gwen, are you hearing the story?
When you go back to the narrative, I'm losing the audio for some reason.
Okay, let me try. I'm just going to hit it one more time, and hopefully the Zoom will pick it up this time. So let me just give me a thumbs up if you hear the story now.
Okay.
When Holly Norton's son brought her to the ER complaining of chest pain, it was obvious that addressing her medical condition was going to require walking a very fine line. The attending physician, Dr. Colin Singer, stood in the hallway reviewing her chart, shaking his head as he looked at the preliminary data. Abnormal EKG, kidney disease treated up until now with medication, and type 2 diabetes. When he came in and sat down with Holly and her son, he tried to be both reassuring as well as realistic. "How are you feeling, Mrs. Norton?" She forced a smile. A little better since the nurse gave me those pills." Dr. Singer lightly patted her arm. "That's a good sign." "Well, I normally wouldn't be as concerned about the results of your EKG, which shows some irregularity, but given your history of kidney disease and diabetes, I think the wise course is to have you stay with us for a couple days for some more tests and evaluation. I'll have..."
I'm not hearing
Listen to your nurse. Call upstairs to
go.
get you a room, and we'll get those tests ordered. Any questions? Holly was sure she had some, but her mind went blank. Her son just shook his head. He could read between the lines that things were pretty serious. Following multiple tests and all kinds of treatments and consultations from a herd of specialists that seemed to stampede through her room every few hours, Dr. Singer came by to review what they had discovered. "The good news, Mrs. Norton, is that we think we can manage your heart condition without any surgery, just medication. The not so good news is that your kidneys still aren't doing so well. Your renal specialist believes we need to continue the dialysis we started you on yesterday. Your nurse will be coming by shortly to go over all the details with you. Believe me, though, I've had a lot of patients on dialysis do just fine, so don't you worry, okay?" Holly muttered, "Okay," as the doctor headed for the door, just wishing her son was there to explain everything. About an hour later, a nurse she'd never seen came into her room and introduced herself. "Mrs. Norton, I'm Megan Osler, the charge nurse. I see that Dr. Singer has discharged you, and I just want to go over everything he's ordered." Over the next 5 minutes, she reviewed the scripts for 9 different medications, along with orders for her to continue with dialysis. She was given a list of all the dialysis centers in the area she could choose from to continue her treatment. "Any questions?" "My son, he'll be picking me up. Can you put all these in an envelope for him?" "No problem. Now you take care." Megan whisked out of the room, leaving Holly feeling both bewildered and more alone than she had ever felt in her whole life. An hour later, her son swung by the hospital, and soon she was home enjoying her favorite late afternoon TV show. 2 days later, Ann Landsman, a nurse on the med-surg floor, gave Holly a call.
Mrs. Norton, this is Ann Landsman. I'm a nurse from the hospital, and I was just checking up on how things are going for you.
Holly was a bit disoriented by the call. All right, I guess.
That's good. Have you been able to get all the prescriptions your doctor ordered?
I think so. My son took care of that. There sure are a lot. Anne proceeded without even asking if she was having any challenges managing all those meds.
And you got an appointment set up for your next dialysis treatment?
On this subject, Holly was a little less certain. You'd have to talk with my son about that.
Okay, well, you call us if you have any issues, you hear?
Yes, Holly responded. Thank you. When she heard the dial tone, she wondered about that dialysis appointment. Had Charlie made it? 2 days later, when he came by to see her, she was incoherent. Charlie didn't hesitate to call 911. When they had her stabilized in the ER, Dr. Singer took him aside. Your mom seems to have been suffering from the effects of uremia. Charlie shrugged, not understanding. Basically, it's blood poisoning from all the untreated waste materials caused by her kidney failure. Did you not get her set up at one of the dialysis clinics after her last discharge? Charlie looked at him quizzically. I didn't know I was supposed to do that. I just saw all the prescriptions she needed and got them filled, but no one told me about dialysis. Dr. Singer was nonplussed. What do you mean no one told you? I mean, when my mom was discharged, the nurse gave me a folder with a bunch of scripts, but that was it, and I took her home. Dr. Singer just shook his head and said under his breath, Unbelievable. Mr. Norton, come on down to my office. I want to go over in detail your mom's care plan. Neither of us are leaving this place until we're both sure you understand every item. Charlie sat down with Dr. Singer, and over the next 20 minutes, they went over every medication. Dr. Singer didn't let him leave until Charlie could recount in detail the meds she was to take and when, her dietary restrictions, and how often she was to get her dialysis. As he was leaving, he said, Thanks, I only wish someone had sat down with me like this the first time. Me too, said Dr. Singer. Me too.
Okay, sorry for the technical difficulties. Of course, it always works perfectly when you practice. I like to follow stories with an open-ended question of, and if you'll use the chat box, we'd love to see some of your responses. What are you concerned about? When you listen to the story, what are the first things that come to your mind that you're concerned about? And so Steve will be monitoring the chat box to share with us some of the things that pop in that are things that you think we should be paying attention to.
The one is the nurse. I'm just kind of reading as they're coming in. What are you concerned most about in this story? The discharge nurse didn't do her job. One comment came in. What are your thoughts on that, Gwen? Just as we get others coming in on this particular story, and what you can learn from this story.
Yeah, that's opens up for a lot of discussion, and especially if discharge planning is one of the objectives in your learning plan, it opens up the opportunity to talk about roles and responsibilities. And of course, that is one of the domains in interprofessional education, is being clear on who's supposed to be doing what. So looking at that would be one of those questions. I also think that using an open-ended question like this helps you to see how learners are thinking. And so you begin to see, well, what is really important? Are they able to set priorities for what's the most important thing? Sometimes I get learners who tell me that they're concerned about Holly's diet. Well, yes, Holly's diet is a big concern, but is that the thing that's the #1 priority for you right now? So we can go through and we can begin to identify some of the points in the story where we do have concerns. Let's look at some of the other chat responses.
One of the things is that the idea of the literacy kind of came up, and this also the idea of a teach back. That's another way we talk about checkbacks in the team steps, but the teach back. What might be the difference when you think about checkbacks and teach backs, or how they might be the same?
That's a good question to think about. We talked about check back as one of the skills within Team Steps, and that's part of the language that's used there. Check back is a lot like I go to Starbucks and I order a decaf cappuccino, and the barrister repeats back exactly what I've just said. Teach back is used when we're trying to do, especially discharge planning. And so we convey, and there are a number of steps in teach back, but we're conveying to the patient the basic information, and then we pause and give the patient, all right, tell me what you heard me say. And so you keep going until they can repeat back. These are really wonderful skills for our learners, especially at the pre-licensure level, to be learning as part of their clinical experience. And it doesn't matter the clinical setting. A lot of Holly's story takes place in acute care hospital, but of course she goes home. And so it gives us the opportunity to also have discussion about outpatient care. What are some other comments or questions?
What are some other ways that you could then go from this kind of, this simulation, if you will, story simulation, and then go into now kind of a practice? Like if you are able to get nurses could go into a discussion room, or students or learners, and they could start practicing check back and using even teach back, for instance. How could you do that, using this type of thinking, the story as a springboard for that?
Yes. If you're using virtual, which a lot of us are going to be doing this fall, you can set students up if you have a large classroom, and you can have them working together in small groups. And so they identify points in the story where a check back or other communication skill, you could also use it if you were working on, for instance, on SBAR. And so you could have them practice that together, almost like a role play. And then if you're concerned about trying to check how well they've accomplished the skill, then you can have each group report back verbally, or if time is critical, you might have them write out a response. In fact, you could use the chat function of Zoom if you're teaching on Zoom. And I really like the comment that I see here that's been added about working with the patient family. And of course, patient-centered care was one of the competencies, and as well as teamwork and collaboration, that we said were primary objectives in this particular story. And nowhere is there really any time where the anybody in the healthcare team sits down with Holly and her son, who is obviously involved in her care, and had a conversation. And so here's another opportunity for role play. For your learners to be able to role play, how would they initiate a conversation? It's a classic example that what we used to call paternal health care, where the patient completely abdicates decision-making. And we now know one of the major components of patient-centered care is shared decision-making. And so how could you bring Charlie, as well as Mrs. Norton, into a conversation together and work with them to make sure everyone understands? What are some other points in the story where there was some miscommunication or where we could do better that you're concerned about?
I know one is this idea of the one was mentioned about the son not even being present, and sort of how does he actually receive communication? And he received it only through this package of materials, and just making an assumption that he understood what to do with that package beyond the scripts that might have been in that discharge package. Anything that you feel like we could have done better there?
Oh yeah, we could have quite a robust discussion on that aspect. It has always bothered me so much about the dialysis. And while we don't know all of the background and history, it's our assumption that Mrs. Norton had not been on dialysis prior to this hospitalization, and that this is one of the outcomes of this hospitalization is the determination that she needs dialysis. But no one did any conversation with her. And when you think about care coordination and transitions in care, it just would have been a wonderful patient-centered care gesture for someone to have taken the time to look up dialysis centers that are in Holly's neighborhood and even have made the first appointment, or given the son the number and said, here's some information on this center, and here's what you would do to be able to accent. But it would have been a great way to help to achieve patient-centered care by including him in that conversation and helping both of them to know how to go about making that first appointment.
Well, Gwen, we've come to the end of our 30 minutes today on getting started with StoryCare. So again, very quickly, just kind of recapping, we were able to, take a story, something that we wanted to focus on, which was communications, patient-centered care, patient safety in this case, as this patient experienced a preventable harm potentially here. Would you agree, Gwen, in this particular scenario?
Absolutely. And those of you who are concerned with economics, this costs this hospital a lot of money to have this readmission and might not be reimbursable because readmitted within 30 days.
Right. So there's another cost. I mean, not just the cost of this to this family, but the cost to the organization. And then, yeah, absolutely. So great. Lots of great learning. We could springboard to many, I think in this story, many other areas that we could learn from and use multiple times and reuse the story for multiple competencies in that regard. And this is just one of, hundreds of stories that are in StoryCare that we can use in this way. And again, I want to thank everyone for getting started. If you haven't got a user ID, log in, feel free to check out the Start Free trial on join.storycare.com. And then for those that are interested in moving forward with your organization or with your school, with your class, and with your students, you can again look at the purchase opportunity as well. If you have any questions about anything we did today, or as you move forward in some of your decision making, as you look for virtual tools like StoryCare or something of this nature to help with your virtual classroom and also the asynchronous learning, again, info@storycare.com is a great way to contact us, and it's all here on join.storycare.com. Any last words from you, Gwen, before we wrap today?
Yes. I like to find good, rich stories like this, and I use them in multiple lessons. And I always tell the students now, we met Holly Norton in another class when we were focusing on check back. And today we're going to be talking about opportunities for quality improvement. So we're going to use the story for you to identify potential quality improvement projects. So you learn one story, but you can use it in multiple ways. And just always, in scaffolding your learning, you're able to use the complexity of stories to really achieve multiple objectives. And just one last thought, we didn't really use this today, but a set of questions that I like to use with stories is what went well, what needs improving, what's the takeaway, and what else do you need to know in order to achieve other parts of the story? So really thank you all for joining with us today.
Yeah, thank you, everyone. And I think that last parting is a whole nother learning that we can do on another future webinar would be around debriefing and the power of debriefing and reflective learning, which Dr. Sherwood has written books on. So I know we have plenty of opportunity to discuss that on a future webinar. So thanks for joining us. Hope to see you again on another StoryCare webinar. Thank you and have a great day.
Thank you. Bye now.